Hello, everyone. Welcome to Pharmacy IR Podcast. My name is Devin Olden, and we have a very special guest today. He goes by the name of Dr. Brandon Warren. How are you doing today, Dr. Warren?
I'm doing well, Devin. How about yourself?
I can't complain. I
Good,
can't
good.
complain. We'll go right into it.
Sounds like a plan to me.
What is your role and responsibilities at your occupation?
Yeah, so it is a unique role, Chief Pharmacy Officer. So within Department of Health and Human Services, there's the Division of State-Operated Healthcare Facilities. Focuses mainly in the behavioral health, substance abuse realm. So just overseeing pharmacy operations at, we call them ADACs, Alcohol, Drug, and Abuse Treatment Centers, psychiatric hospitals, neuromedical treatment centers, developmental centers, and then a couple residential children's programs. But again, just it's pretty cool. Like I say, I'm really interested in behavioral health and just mental health in general. So I enjoy what I do.
Okay, so what are your main responsibilities at this job, and what does your day-to-day look like?
A lot of emails, for better or for worse, a lot of emails. No, so it's really unique in that you still help folks, but in like a more systematic way per se, like evaluating drug therapies and formularies, a lot in the COVID space, because that's just where we are in the world right now. And then also kind of on the contractual side of things, so business, purchasing, financing. So again, it takes some getting used to, because historically, I'm kind of in that direct eye-to-eye, face-to-face realm.
Right.
So it's still helping folks, but in a little bit different capacity. And being with the state's a really awesome gig. You get to serve a lot of like underserved, underprivileged communities, things of that nature. So yeah.
Okay. So on a daily basis, are you typically face to face with the patient, or is it more on the administrative side where it's more like policies or so?
Yeah, 100% the latter of that. And like I say, it takes some getting used to, because
Gotcha.
I'm very much like a front facing, like to talk, engage, that kind of thing. But yeah, unless we're doing site visits, which I mean we do that. But as far as direct face to face interaction with depending on the setting, we may refer to them as patients or residents. My job prior to this was a lot of that, but now it's more on the administrative side of things, like you mentioned.
Okay. And how exactly did you get started in this position, or what led you to this position? Because many times in the profession or in pharmacy, it's the traditional route is more like clinical, more retail. So how did you end up in your position?
That's a good question, my friend. No, and it's funny you said that, because I was actually did a lecture prior to this and was just speaking to them about it. You're absolutely right. To some degree, when you're in school, it's kind of like retail or hospital.
Yeah.
And I mean, like the school will tell you that's not the case, but a lot of times that's kind of your fork in the road, and those two are your options. So for me personally, I started working in retail pharmacy when I was in high school, independently on, and I knew 120%, no doubt in my mind, as Professor Perkins can attest, like I was going to own my own pharmacy, no doubt about it, 100%. And then so went through school and came out and worked in 2 independent pharmacies right out of school. And I enjoyed talking to people. Like I still enjoy that, and I miss that, if we're being honest. But the satisfaction wasn't there. Maybe you're going through school, and it's what I was trying to speak to the students about. You've got this vast array of opportunities, and you've got all this knowledge, and you've got all this training. And again, I'm not saying it's this way in every retail setting. But you just don't use a lot of that, and it was hard for me to kind of like, I don't want to say sleep at night, but it was hard for me to know that I knew all these really cool things that could help people. But
was this during your like P4 year when you realized this, or this is after you
no,
graduated?
after,
Gotcha.
yeah, it was probably 4 years after I'd graduated. And so, like I had this like bevy of knowledge, and then just couldn't use it in that setting. So I got within the state system at J. Iverson Riddle Developmental Center.
Okay.
Amazing place. Amazing place. At the time, we had about 300 folks, IDD, intellectually and developmentally disabled. A group that we took incredible care of. And so I took over just like a clinical pharmacist role there. And yeah, like done some good things there, made some progress, started a couple initiatives. And then the director at the time retired. So I took over director of pharmacy services just at Riddle. And kept digging, like made some changes and some plans and things of that nature, both financially and clinically. And then the role that I'm in now, chief pharmacy officer for all these DSOL facilities, that role came open. Applied for it and was fortunate enough to get it. And so, yeah, I mean, it's, I suppose maybe like a lot of things in life, a lot of work and a little bit of luck.
Yeah.
Or, I was saying I'd rather be lucky as good any day.
Yeah.
So, yeah, no, like I say, a lot of, it's a very weavy, awkward path, but I don't regret it. I don't regret it at all.
Okay. So did it ever feel uncomfortable, the path that you were going?
Yes. Yeah.
Because it wasn't clinical, or I mean, well, not clinical, but because it wasn't in the hospital, or because it wasn't in retail, that's why it felt that way, or because this is something like brand new, other people aren't doing it.
So no, it's a great question. So when I first came to Riddle in the more clinical role, it was a little uncomfortable just because like I had the hospital training through school and I'd had the retail training through work, but that's like a kind of sort of nuanced long-term care set. I mean, it's not considered technically long-term care, but it functions in that capacity. So learning a lot of the regulatory pieces of that, it's ICF is kind of the overseeing body. So learning those pieces and revisiting things like dosing anticonvulsants and your inducers and inhibitors, revisiting some of that stuff. But overall, that was a subset of knowledge that I had. I just kind of had to unlock it and revisit it. The true kind of and you get through it uncomfortable. The role that I'm in now, like I didn't get trained on contracts, things of that nature. Like there's a lot of things I do right now that you just don't learn about in school because it is such a unique spot. And oh, by the way, like the day that I took over in that role was like literally the first day COVID vaccines came out.
Perfect timing.
So, it's like this job that like I know about it, but I need to learn it. And then I don't know, the biggest vaccine rollout in human history.
Yeah.
So there were some sleepless nights in there in the beginning. But I mean, we vaccinated our folks, like our residents, the staff. And then the therapeutics hit with your monoclonal antibodies, remdesivir, Paxlovid, molnupiravir, you name it. So it was a stressful and, as you put it, uncomfortable time, but kind of more level footing, day in and day out becomes, I don't want to say routine because each day has a challenge, but you feel prepared to handle it.
Okay. And let's talk about the learning curve. Was the learning curve for this position that you're in now, is it steeper than when you had to learn about cardiovascular, when you had to learn about neuropsych, when you had to learn about GI?
Yeah, I would think so. And the reason I say, and I'm not saying, like cardio and stuff is not just like, easy to learn. I suppose probably the best way to put it is if you're talking about ID, you're talking about cardio, or you're talking about oncology, whatever your topic is, you've got a book. Now, I mean, there's ongoing studies and new literature and new practice and new things, but you've got a book, you've got a template to learn from. A lot of what this world is like managing people, speaking with drug wholesalers, regulatory components, because depending on our facility, some live in a joint commission world, some live in an ICF world, some live in a SAMHSA world. So yeah, it is more challenging again, just because you don't necessarily, it's so unique and so varied across facilities. You don't have like a central playbook to pull from. And so it's challenging, but I like that challenge.
Mm.
And that's one thing I talk when I have students is it hard to not have that playbook to pull from? Absolutely. You can kind of make your own playbook,
Ooh.
and that's a unique
Yeah.
thing, like you can like be real creative and kind of implement some new cool things, like say yeah, regulatory, financially, clinically, you name it. You kind of, again, I don't want to say there's not a skeleton there you abide by, but you get some flexibility to do some really neat, innovative things.
And I think with that, like as a student, sometimes it's hard to play the game whenever you're just trying to learn the rules. Like, okay,
Hmm.
I don't want to harm anybody. I'm trying to,
Yeah,
make sure I put forth the safest thing, and also legal. Something that's legal
absolutely.
before we can even bend the rules a little. Not even bend the rules, but change the perspective on things of like how you approach certain therapies, how you approach like policies and things like that. That may be the most challenging. I could
Hmm.
see someone like let's say in my position moving forward, and or a Dr. Brandon Warren Jr. who may want to like do that. So I could definitely see that as a challenge. So what types of students do you think would be interested? Like as in characteristics, qualities, would be interested in your role?
That's a good question. You kind of caught me off guard with that one. Um,
Or even electives that they may want to take to prepare.
yeah, so anything regulatory wise would help. That certainly help. I think probably and I'm going to kind of contradict myself here, but just roll with it. You need to be detail oriented, like,
Mm.
but also you need to be able to step back to the big picture. Because if you start getting in the weeds of certain topics, kind of the greater good folds to the side, if that makes
Right.
sense. So like I say, as oxymoronic as that is, detail oriented, but can still also see the big picture. Um, as far as other qualities, I mean, you've got to have the desire to serve. So like using my background as independent retail pharmacy, had I owned my own pharmacy, which didn't come to be, I would have certainly made more money. Like,
Mm.
and I don't mean that in like any kind of arrogant way. Like
Right.
there would have just been more money involved with that. But I wouldn't have felt like I was serving. Like I wouldn't have felt like I was giving back, especially in the mental health space, which is like severely lacking from where it would be in an ideal world. And COVID's only exacerbated that with like the depression rates and anxiety and
Mm.
things of that nature.
Yeah.
So yeah, that would be a big one. Is just the desire to serve. Because there's like any job, there's good days and there's bad days.
Always.
But kind of remembering that you're taking care indirectly, but you're taking care of a population that largely goes unattended to, is certainly a motivating factor.
Okay. Okay. And on your way to where you're at now, this point of success, did you have any mentors or any friends that really pushed you, family members, professors, etc., that really got you that really took you over the top? That said, like, you know what, I can do this. I recommend you do X, Y, and Z. Were there any of those people on the way?
Um, yeah, another one that's I kind of got to think through here. So, I mean, kind of like I'm a super big family guy. So, just on a human level, emotional level, like my family was there every step of the way. And now that I have a niece and nephew, and I see my parents in action, like they're solid parents.
Oh
Like
yeah.
wouldn't have got where I'm at without them. Now on a more professional side, and I'm sure Scott remembers her. Lisa Mead was huge. I had her for multiple rotations, and we were fortunate that just proximity wise, we were kind of sort of based in Hickory.
Okay.
Um, so she was a huge, huge factor. And then I would say outside of, because Lisa kind of she kind of kept reminding me that there's a world out there besides the retail.
Oh, so she
And
was a retail.
no.
Okay, gotcha.
She's a preceptor, like coordinator for Wing It.
Oh, gotcha,
Hmm.
gotcha.
And I think to some degree she never told me this, but she probably saw that retail wasn't going to be my best fit, even no matter how sold on it I was. So very much appreciative of her. And then also, so the individual that I'm in this chief pharmacy role with, the previous was Angela Smith. She's incredible.
Okay,
She's
okay.
man, she's a go getter. She's smarter than I am, and
Very detail oriented, like some
yeah,
of the
yeah.
similar characteristics.
And
Gotcha.
she started a really cool things with state pharmacy. She's since transitioned to another. She's still within the state, but another state role. So she was a big one because she imparted a lot of things while I was at Riddle that weren't on my radar. But when she said, it, I was like, wow, like why didn't I think of that? That makes sense.
Yeah.
So I'd say probably, again, not to be long winded, which I guess I am
No,
at
you're
this
fine.
point. Mom and dad family vibe on that level. Professional, Lisa Mead and Angela Smith. Certainly don't think I'd be here professionally without those two
Yeah.
kind of, and that's where the luck comes in.
Yeah.
Like
Yeah.
I consider myself a hard worker, not the smartest guy in the room, but not dumb either.
Mhm.
But without just kind of the way things folded in with Lisa and Angel and some of the other people I've met along the way, uh, ended up where I'm at now.
And that actually leads me into my next question of how did you find these mentors, or what would you recommend to students that are looking for mentors? Because I've experienced that actually, like maybe over the past couple months, where they'll say, "How did you meet such and such?" Or should they intentionally try to find mentors, or should it just kind of happen, like fall in their lap? Like, well, I was just doing my rotation and I just found a liking to this person. What would you recommend? And how did you find your mentors?
So it's actually kind of both. Like the biggest recommendation I have, and I didn't always do this, get uncomfortable. Like reach out and take that rotation that you don't understand, or talk to that provider that you see something in and you want to know something, especially as a student. And I don't want to downplay being a student or the things you do in rotation. But you have a luxury there of, like, there were questions I would ask and things I would do as a student that I probably wouldn't have done, like if I were actually like a pharmacist employed by that organization.
Is it because of the expectation of you're supposed to know this? Or
Yes.
okay. So we
Yeah.
kind of have some grace
Yeah.
as a student.
Exactly. Yeah.
Gotcha.
Yeah. 100%. And like I say, none of that is of like the wild, wild west,
Yeah,
100 milligrams of cumin and nothing like that. I would just say, like I say, you have the opportunity to ask and be inquisitive and to see and to do, and every chance you get to do that, take advantage of it. Professional organizations, so whether it's like NCAP, ASHP, you name it, networking's never a bad thing. And I'm not like a huge networking guy, but it helps. And then truthfully, like just work hard. And I don't
Yeah.
mean that like, oh yeah, just work hard.
All you
Everything
have to do.
yeah, that's
Yeah.
all you have to do. I don't mean it that way. What I'm driving at with that is your reputation will kind of speak for itself. And so if you work hard, you get uncomfortable, your name kind of gets out there and you just meet people. And then if there's one, silver linings with COVID are hard to come by, 100%.
Gotcha.
But COVID has brought together historically siloed entities, like pharmacists working with all these other professions. And then now we have more emphasis on public health. We have more emphasis on health departments. We have more appreciation of like the international workings of disease and travel and things of that nature. So again, that's kind of brought it into the fold. And then, oh, by the way, like we can give, the COVID vaccines, we can to some degree prescribe Paxlovid. We can give there for a while some of your monoclonal antibodies. So again, No, I would rather COVID not happen.
Right, right.
Don't get me twisted on that. But it has like opened up some dialogue and some interplay and really kind of like progressed pharmacy further along than we were, into 2019, beginning of 2020.
Okay, okay. And last question. So what are some challenges that, being respectful of your time, what are some challenges that you've experienced, whether if it's professionally or personally, socially, that you've experienced?
That's a good question. COVID. I mean,
Yeah, yeah.
no. So COVID's kind of a given. You don't even have to really say that. The state functions. There's it's kind of like there's so many different cogs in that machine, and learning all those pieces, from a contracting, legal, like, it's not as straightforward, as I suppose just, filling scripts at a retail pharmacy. So that's certainly a challenge. And it was in the beginning. I'm a little bit better with it now, but not having that direct face-to-face interaction with either a customer at a store or a patient or a resident in a facility, that was tough.
Yeah.
But you find other ways to interact where you can. Just trying to think if there's really been anything else. Keeping Scott as a friend, that's a challenge day in and day out. I mean, I totally mess with it. He's an awesome guy. But yeah, and then also maybe another challenge is not trying to think how to phrase this, not slipping into a routine. Like you take over a job and you might institute and do some cool things in the beginning when you're like fresh and you want energetic about it. Yeah. And then, that 1 year turns to two turns to three, and you kind of get to a level of complacency. And I'm guilty of that. I'm not, going to pretend like I'm not, but just kind of like reinventing yourself or innovating, and not just getting in that same whole hum, straightforward line. So that's a challenge too. Absolutely. Gotcha. And you'll see that as you go forward.
Yeah, cool, pretty soon.
Yeah.
Pretty soon. Yep. Everyone, you've heard it yourself from the man himself, Dr. Brandon Warren. Thank you so much for your time.
And I will say the only people to call me doctor are when they want a donation. So, just Brandon Warren's completely fine with me.
Dr. Brandon Warren, everyone.
There we go.
Thank you.
Thank you, Dale.